Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Friday, January 31st. It is 5 p.m. You may not be able to tell, but I'm visiting my parents, so different venue for me. Sometimes I do it outside, but I always get interrupted by people walking past, so here I am inside. So we've been talking about seasonal affective disorder and ways to treat it. And we started with nutrition and exercise. And then we talked about vitamin D. We talked about blue light and correcting sleep-wake cycles to correct your melatonin levels. But as I mentioned the other day, neurotransmitters in the brain are decreased in people with seasonal affective disorders. So things that can increase these neurotransmitters naturally would be an effective and beneficial option for people that are suffering from this. Now, studies have shown that some essential oils, no surprise there that you knew I was going to talk about it, can help relieve stress, anxiety, and depression, and can stimulate the brain to increase neurotransmitters such as serotonin and dopamine to help regulate mood. So interesting facts, people with depression often have decreased olfactory sensitivity. Basically, they have a decreased sense of smell. But people with seasonal affective disorder actually have an increased sensitivity to smell, which means that they are absolutely more likely to respond to aromatherapy than the average person with depression. Now, that's not to say somebody with depression won't respond, but these people are more likely to respond, which is awesome. Now, a study of aromatherapy using lemon, bergamot, and orange, so citrus essential oils, they are known to be happy oils. That's what we call them. They were diffused daily in this study for 2 weeks, allowed patients who were taking antidepressants to actually feel better and decrease their dose without worsening their symptoms. That was just in 2 weeks. Now, if you're currently taking prescription medications for seasonal affective disorder or any other forms of depression, essential oils may be options for you. But please do not discontinue any prescription without talking to your doctor about your intentions to do this. Okay? And most doctors are going to look at you like you have 3 eyes, 2 horns, and you are weird, because most traditional medical doctors don't know anything about essential oils. Just saying. Okay. Many studies about essential oils were quoted in an article by Robert Tisserand, who is a known expert on essential oils. So if you follow essential oils at all, that name he is one of the gurus, okay? And he talks a lot about essential oil safety. Now, he references many oils that are uplifting and can be used to help with seasonal affective disorder due to the ability to increase these neurotransmitters when used aromatically. So he talks about a few of them, and I'm going to mention some of them. Number 1 was black pepper. Not black pepper the spice. Black pepper, the essential oil, has been shown to increase epinephrine when inhaled. It's actually one that I recommend to people who are trying to quit smoking for the same reason. Nicotine causes an increase in your catecholamines, your adrenaline, so it kind of mimics that while you're trying to wean off the tobacco. Number 2 essential oil is grapefruit. Grapefruit increases sympathetic nervous system activity by about 50%, which is a pretty significant number. Jasmine essential oil is widely regarded as an antidepressant in the world of essential oils. Lemon increases serotonin and dopamine. Rosemary is also known to improve memory, but this oil acts on serotonin receptors directly and can have a positive response in these people with seasonal affective disorder. Bergamot reduces anxiety and stress. Clary sage increases dopamine and serotonin. We use that one a lot for PMS in my house. I mean, like, you really need some happy oils that time of the month. Orange decreases anxiety, improves mood by increasing serotonin levels. Rose oil is beautiful. It's shown to relieve stress and improve mood. Sandalwood, used for depression in other cultures. And patchouli increases dopamine and serotonin. Now, I just gave you a list of 11 essential oils. I can go on and on with other oils known to improve mood. I mean, mood is a huge area with essential oils and very, very effective. Other oils would be basil, peppermint, lavender, frankincense, Roman chamomile, vetiver, ylang ylang. Like I said, I could go on and on and on. You know, this is what I love and what I can talk about. So if you have seasonal affective disorder, please, this is a way to really get these natural oils into your body to make you feel better and not give you sorry, I'm getting interrupted by my parents' dog, and not give you the need to take a prescription medication. Now, if you have not used essential oils to improve mood in the past, winter is a great time to give it a try, because even if you do not have seasonal affective disorder, it's kind of depressing in some places in the winter. I mean, it's just gray and gloomy many days. So give it a try. Now, clearly the quality of the oils you use are going to make a huge difference. So if you want high quality oils, I'm your gal. So on that note, I hope you guys have a lot of wonderful, fun things planned for this weekend. I know it's Super Bowl on Sunday. Have a great time. It's Friday at 5 o'clock, at least here on the East Coast. And that's what I have for you. So I will see you again on Monday for another Live in 5.